So in today's chapter, nutritional and food requirements for lactating women, page number 167, chapter 9. Those who have the new edition textbook, please mention the page number in the chat box. If anyone is joining late, please help them out with the page numbers. On 67 page number in the new textbook as well. So first, understanding the stimulation of milk production. Okay, after pregnancy, how after giving birth, and even through the third trimester also sometimes the milk production is there. Okay, but once the baby is born and once the breastfeeding is initiated, how does milk production start? So when the infant is sucking on the mother's nipples, it causes a stimulation. Okay, that will stimulate the hypothalamus. Okay, the sucking action from the nipples, it will stimulate the hypothalamus of the mother. The hypothalamus is situated here in the brain. Okay, so once the hypothalamus gets stimulated, it will stimulate the pituitary gland as well. Okay, pituitary gland has two parts: anterior pituitary, that is the front part of the pituitary; posterior pituitary, that is the behind part of the pituitary. Okay, so pituitary gland has these two parts. You can see on the image here on the right: anterior pituitary in the front, posterior in the back. Okay, so once hypothalamus gets stimulated, you can see how close the hypothalamus is with the pituitary gland. Once this gets stimulated because of the sucking reflex, pituitary gland will also get stimulated. So anterior pituitary will produce prolactin, posterior pituitary will produce oxytocin. Okay. So anterior pituitary, once it produces prolactin, milk production will begin in the cells, in the breast cells. Okay. And once oxytocin is been released, the mother's breast cells, milk production cells, will release the milk out into the nipples. Okay. And that the child will keep sucking onto. Okay. And this cycle goes on. So that's how milk production takes place. Okay, so that's when you initiate breastfeeding. Okay, as long as the mother does not stop the breastfeeding, the milk production will be there. Usually, in 80 to 90% of cases, it's like that. As long as the child is sucking onto the mother's breast, nipples, okay, milk production will be there. Okay. So these are the hormones that control the entire process of lactation. Okay, milk production, lactation. First is your estrogen. Estrogen is secreted by your ovaries that will develop the breast. During pregnancy, the breast size will increase. Okay, that is because of hormone estrogen secreted by the ovaries. Okay, then progesterone. In a non-pregnant woman, again, it's the ovaries that will secrete progesterone as well, especially corpus luteum. Okay, but in the pregnant woman, the ovaries will secrete progesterone. Okay, When a woman is pregnant, there is no corpus luteum. Okay. So placenta will take the role of secreting progesterone. Okay. So that will prepare the breast milk production by it will increase the glandular cells into secretory cells. Okay. The breast tissues in women, okay, the breast tissue cells in women, they are glandular cells. Okay. Because of progesterone secreted by the placenta, these glandular cells will convert into secreting cells. Okay. So glandular cells will convert into secreting cells. Prolactin is secreted by anterior pituitary, as we have seen earlier, that will stimulate the milk production. Secreting cells have to still produce the milk. Okay. So prolactin will help in the milk production. Oxytocin will help in the release of milk from the glands. Okay. So these are the four main hormones that plays an important role in maintaining the lactation. Okay. Is it clear to all so far? So coming to the nutritional requirements, energy requirements of lactating mothers, whatever an adult woman would be having in terms of calories, in the first 6 months of breastfeeding, she has to add at least 600 calories more. Okay, that is one additional full meal. One additional full meal, at least she has to add on to the baseline calorie requirement. For example, if an adult woman who has a sedentary lifestyle and her calorie intake, okay, is around 1400 or 1500 plus 600 should be during the first 6 months of breastfeeding, exclusive breastfeeding. Okay. Then you can reduce the calorie. Okay. It can go up to 500 kilocalories for the next 6 months, because now the child is not only dependent on breast milk, the child is getting its calories from other weaning food as well. Okay. So it's not that completely dependent. So slowly, mothers can reduce their calories as well. As the child becomes less and less dependent on breast milk, mothers can reduce their calorie intake. The protein intake, baseline is around 55 grams of protein per day. Every woman should have at least 55 grams of protein plus 9 grams. During lactation, additional 9 grams to the baseline 54. So at least 65 grams of protein has to be taken. Fat not more than 50 grams. Okay. Fat not more than 50 grams. Whatever is the baseline fat intake of the mother, add the correct amount of fat to an extent that it does not cross, adding up 20 and 30, it should not cross 50. Okay. So not more than 50 grams of fat per day. Then calcium, 1200 mg. The highest requirement of calcium is in lactating women. Okay, they require 1200 mg of calcium per day. Increasing the dairy products can help you achieve it. Iron, 26 mg. Okay, that's an average requirement, 26 to 27 mg. Then vitamin A, whatever is the baseline requirement for an adult woman based on her lifestyle, sedentary, moderate, active. So based on her lifestyle, whatever vitamin A she has to take, plus 350 microgram. So vitamin B, you can check page 177. In detail, they have mentioned what is the vitamin B requirements. Vitamin C, at least 2 to 3 servings of fruits per day. So total of 80 mg per day, at least. So 2 to 3 servings of fruits per day. Then fluids, water, 2 to 3 liters of water daily should be taken. Coming to the guidelines, so during lactation, maximum requirement of nutrition is there as compared to any other age in a woman's life. Okay. During lactation, her calorie requirements are the highest and diet should be balanced. Okay. It should meet all the requirement. It should correct any deficiency. You can increase the number of meals per day that you eat. For example, before pregnancy or during pregnancy, 2 to 3 meals per day you are having. During lactation, at least 4 meals per day you have to stick to. Balanced diet, which means all the food groups should be there in the diet: whole grains, cereals, complex carbohydrates, good fat, good proteins, minerals. In adequate amount, it should be there in the plate. So different beverages are good so that it hydrates the mother, okay, and also provides some nutritional benefit as compared to drinking plain water. At least 1 liter of milk every day, lactating mother has to take. If she can't take 1 liter of milk, at least 500 ml of milk, 500 ml of either curd, buttermilk, or any equivalent, okay, has to be taken. Then increase the quantity of food that you eat per meal. If you can't add one extra meal into your diet, just increase the quantity of the meal that you have in per serving. Then variety should be there so that major vitamins can be balanced out and it is not just one vitamin standing against so many small amounts of vitamin. Okay, so variety should be there so that all the physiological functions are carried out well. Supplements can be taken if you have a very busy lifestyle and you are a new mother and you have a very busy lifestyle. Supplements can help you with your protein requirements or vitamins and mineral requirement, omega-3 requirement. Supplements can be beneficial under the guidance of your gynecologist or obstetrician. Teenage mothers and multiple pregnancy, they have to take special care about their diet. And also regarding the diet of the fetus, which is growing inside, it's seen that women who are very young or women usually who are from the lower economic class groups, they usually give birth to low birth weight baby. Okay, so teenage mothers, mothers who have multiple pregnancies are always at risk of developing complications of pregnancy. Next is lactogogues. Lactogogues are certain types of food which are said to increase the milk production. Okay, we don't have much proof of that, but traditionally lactogogues are used so that uh, a woman can produce enough amount of milk. So these are some of the lactobacillus: garlic, oats, almonds, methi, okay, coconut, poppy seeds, gond, leafy vegetables, dill leaves, dill seeds, sago, okay, sabudana and all. So these are lactobacillus. They are supposed to increase the milk production. And you must have seen this if a woman is pregnant or lactating, she is given methi ke laddus and all, okay, which is made by poppy seeds, gold, a lot of fruits and nuts. Methi is the main ingredient, okay. Now coming to the food requirements, weight management has to be done, okay. Usually in the first 6 months of exclusive breastfeeding, the lower body weight will be lost by the woman, because usually the lower body weight stored in upper thighs, thighs in general, and the hips, okay, and the pelvic region. Those are the fat that will be used up for milk production, because that is high in DHA. Okay, women who have pear-shaped body, who have heavy thighs, okay, heavier buttocks and all, they store a lot of omega-3 fatty acids, DHA, in these areas. Okay, so that's kind of a sign that during the first 6 months of breastfeeding, the lower body fat will be lost, because these fat is being mobilized to use up for milk production. Obese women who are already obese and who are pregnant, they have to control their calories. Their weight gain should not be more than 15 kg and all. Okay. Substantial weight gain based on their obesity is fine. Coming to caffeine. Caffeine, what do you think? Would you allow a pregnant woman to have tea and coffee? You don't have to completely stop coffee intake or tea intake. Tea is much more safer. Okay. Herbal teas and all, they are good. Those who are dependent on coffee, at least 2 cups a day you can have, but not big, large cups. Okay. Medium sized cups, 180 ml or 150 ml of coffee per cup. So not more than 250 or 300 ml of coffee per day. Okay. If you can limit that, and don't go for very strong coffee. Okay. Medium to light to medium coffee is enough. Okay. That is fine with lactating mothers as well as pregnant mothers. Okay. Any allergenic food, if the mothers are sensitive to specific kind of food, there are high chances that during lactation, it can be passed down to the child as well. Okay. Cow's milk, fish, eggs, peanuts, meat. Okay. Anything that the mother is allergic to, avoid that, because the infant can also react to that same food in the same manner. Any contaminants like pesticides, herbicides, any artificial flavors, too much of preservatives in the food. These things should be avoided. Expressed milk, breast milk can be expressed if the infant is not hungry, and if the mother is still producing breast milk, it's not stopping. She can express the milk out, store it, okay, in the refrigerator. In room temperature, if she is storing, within 5 to 6 hours, it has to be used. Okay. For an entire day, you can store it in the refrigerator. You can freeze it as well and use it for the next 6 months. Okay. Breast milks can be frozen as well. And in small batches, you have to store. Human milk pack is also available for this purpose. Then exercise, light exercise is allowed. Okay, for women, they can do few exercises like postpartum exercises and all. And when the lactation is well established, she can do aerobic exercise, which can increase the heart rate a little bit. Little bit of cardio will also be fine. But very strenuous exercise like uh, hiking, trekking, rock climbing, okay, contact sports, these things has to be avoided. Any light aerobic exercise and all like brisk walking, jogging, swimming, this can be fine. But any tedious, too much of sternness and tedious exercise, that has to be avoided. These are the exercises which you can allow for the pregnant woman or lactating woman, like stair climbing, walking, treadmill walking, cycling, swimming. It's allowed. Lactation failure, that is also another situation that a lot of mothers, young mothers, usually they uh, endure this. Okay, lactation failure could be of various reasons in which the mother is not feeling confident enough. Okay, if she is malnourished, if she is on certain medications that is suppressing the activity of pituitary gland, if she has some endocrine disorders, okay, that affects the pituitary gland, okay, or the thyroid disorders, okay, these can lead to lactation failure, okay, but that's very rare. Inverted nipples and all that can also cause some lactation failures in mothers. Certain medications that, if the mother is taking these medications, she should stop the lactation. She should stop breastfeeding the child as long as she is taking these medications. Okay. So if she is taking anti-cancer drug, that can cause immunosuppression in the child. If the mother is on chemotherapy drugs, anti-cancer drugs, and again she's breastfeeding the child. Okay, these chemotherapy drugs can suppress the immunity of the child. The child will be at risk of a lot of infections. Okay. Then anti-thyroid medications, iodine medications. So that can damage the thyroid tissue of the infant. Okay. If the mother is taking medications for hypothyroidism, okay, it can also affect the child's thyroid tissue as well. That can damage the child's thyroid tissue as well. And if the mother is taking any ergotherapies for like for migraine and all, okay, headaches, severe headaches, migraines, if the mother is taking ergotherapy, those medications can cause vomiting and diarrhea in the child. Oral pills, oral pills like thiazides, okay, or oral contraceptive pills and all that can suppress lactation. If the mother is taking any birth control pills and all, that can suppress lactation. Laxatives, if the mother is taking laxative, if the mother is suffering from constipation, she is taking laxative, it can cause diarrhea in the child. Antibiotics, if the mother is on antibiotics, the child may get GI disorders if the breastfeeding is continued. Then Indian nursing mother, it is not there in the new edition textbook, I guess, about Indian nursing mothers. So in India, we face a lot of issues regarding malnourishment in women, anemia in women. Okay, that affects the health of the next generation as well. Okay, for example, in some poor communities in India, where the mother is only taking rice, okay, and little bit of dal or some sabzi, okay, and milk, whatever the mother gets the milk, it is through tea and coffee, which is not enough. Okay, so if the mother is having this kind of diet, which is not enough for her nutrition, to maintain the lactation, there are high chances the mother as well as the baby both will be pushed into malnourishment. Okay, and in India, we can also see that's a custom that at least for 3 years, 2 years, breastfeeding is done for the child, but they are not adding good quality weaning food to the child's diet. They are not starting weaning at the right time. Okay, it is delayed, or when the weaning starts, the right choice of food is not made for the children. Okay, so that can also push the child into malnourishment. And it is seen that some studies that National Institute of Nutrition that has done, women who come from a very low income groups, they do not have adequate weight gain during pregnancy. That is, they may be weighing less than 40 kg. Okay, 40-45 kg. If the woman is less than 45 kg, there are high chances that she will give birth to a low birth weight baby. And because of this energy stress, mother's tissues will also get depleted out of energy. Okay, it can push the mothers into malnourishment. Early risk of osteoporosis, this can take place. So under the ICDS program, Integrated Child Development Program, to prevent this situation, 160 gram of sattu mavu, okay, this is sattu mavu, which is given to lactating mothers, okay, in a 15 days quota. Every 15 days, 160 gram of sattu mavu is given. And once this quota is done, again, the mother has to go to the PHC or wherever the ICDS sub-center is there. The lactating mother should go there. She will get for the next 15 days. So every 15 days, these sachets she will get. Okay. It's a health mix, sattu mavu. So it gives 600 kilocalories, ideal for the first 6 months of breastfeeding. And it has 18 to 20 grams of protein. Okay. So that takes care of the mother's protein requirement as well. And what all things are there in the sattu mavu, you can see here on the chart. At home also you can make this. Okay. You can make laddu out of it, or you can just make a malt out of it, mix it with water or milk and give it to the mother. Okay. So soya, which is good for protein, cardamom for taste and flavor, corn petals, corn pearls, sorghum, that is jowar. Okay, sorghum is jowar, cholam, and black gram, sabudana, sago seeds, Bengal gram, chana dal. Okay, ragi, finger millet, green gram, that is moong dal, red rice, badam, cashews. Okay, normal rice can also be used, whatever is available. Has to be toasted a little bit. Okay. You can see here almost all the legumes and pulses used here. They are of similar quantity. Okay. If you are using 30 gram of rice, 30 gram of all the other ingredients except for cardamom. Okay. Because that gives flavor profile. Except for that, all the other cereals and legumes, nuts as well should be around the same gram. Okay. You can lightly toast it, ground it, and store it and use it in milk or use it as a malt. Okay, ideal for lactating mothers. 160 gram of this uh, flour has to be used per day. Is it clear to all? So any doubts here, you can ask in the chat box. I'll show